When I go cycling, the first thing that comes to my mind is freedom.
Well, the challenge, getting your pulse rate up, that's just nice.
Had my factor in the morning. I am a bike rider, like solely. When I've had my treatment and I've been diligent with that, it's the confidence to then not think I'm a haemophiliac. We're in Florence right now. I have met with 2 other haemophiliacs who cycle, one older, one younger.
This morning I was riding like in a dream, because I was riding with Henrik, that is a friend of mine from Denmark and an hemophilic guy, and also with Alex Dowsett, that it's an ex-professional cyclist that won so many stages in very important races.
Well, I've been riding with Alec and Giacomo, who are both really skilled racing bike riders, which I'm not. This is the first time in more than 10 years I'm on a normal bike, but it was good fun, and I really enjoy seeing the ability they have to use their body in full.
That's probably the first time I've ever ridden with haemophiliac cyclists. I think the thing with Henrik and Giacomo is we're a very visual representation of how far treatment has come. It's quite almost emotional listening to Henrik list which joints have and haven't been replaced. But he's managing it, and he's managing it with a smile. He's positive.
I have 2 ankles. One is replaced and one is stiffened. I have 2 knee joints that are replaced. When I was young, the treatment we were offered, there were treatments available, but they were bad. So it was really hard to treat hemophilia when I was young. There's a little pressure because I can't bend enough, so I can feel that. I would normally have the saddle really high because I couldn't bend the knees. But I love the feeling of using the body. I always loved that, and you get that riding a bike.
And then there's me, who's had the career that I've had. A couple of joint nuisances, but probably not worth mentioning in the same conversation as Henrik, who's having to manage so much. And then you've got Giacomo, who's much younger, who's never had an issue. Like, he wouldn't know what a joint problem feels like, let alone managing ongoing implications of joint bleeds from childhood.
When my life came to the lowest point, when I lose my father, I think that I have to do something in order to improve my quality of life. And I started thinking about doing cycling, not only to watching the television. So I talked with my doctor. At the first time it was like, no, you can't swim. Swimming is perfect for you. The real thing is that he supports me a lot, because he understands the importance that cycling is for us, for me. And he was very happy when I get the first results, when I get the article on the journal, because it was a very good moment for him, because he understands that an hemophilic guy from his center is able to do something that he can't think about it. I think that the treatments are improving constantly during this year, so I think we can be very safe during sports, also in older ages. Knowing my level of factors gives me the confidence to do all the things that I do normally in my life, especially cycling.
I don't think I'm that old in my head. Actually, I don't think old when I consider if I do stuff or anything. I just want to try something and think, let's do it. Let's see what happens. What you can always do yourself is decide what you do with what you got, being time or options for joints or whatever it is. You can decide, how do I treat my life with what I got.
I've broken 2 ribs, shoulder blade, collarbone, elbow, thumb, not all at the same time. And surgery on a few of them, and haemophilia was never, it was a consideration, but it was never a problem. It just makes sure my levels are okay, operate, go home and recover like a normal person. I believe that a healthy joint is an active joint. And to just go about my day without haemophilia in my mind in any capacity, it's just about removing haemophilia from the equation of life.
I think that everyone has to do some body activities, some sports activities, because it will be a moment for yourself. It's not only with cycling. Cycling is a way to do it, and it's my way, my preferred way, but I think that everyone of us have to take part of a situation that can be useful in order to improve mind, in order to improve their body, and in order to improve themselves too. So I suggest you to try whatever sports you want, but not keeping yourself apart because you have some fears. You try it, you speak with your doctor, you will choose the right treatment in order to affront the sport that you want to, and you have to go. You have to go, you have to try.
So we have to change the mindset. It matters a lot how you think about things.
Yeah.
If there should be hemophilians at my age that have not been engaged in a lot of physical activity, but they think maybe I should, go ahead, do it. If there's something you think you would like to try it out. Find out if it's for you, and you might find out it's not. If we get a little bleed out of that, we're probably going to live through that too. So yeah, go ahead and go for it.
Henrik's pretty quick on the downhills.
What's he saying?